I'll tell you, I'm ready for it to be over.
Yeah.
Yeah, it's been a long run this time, but we've been busy. A lot of people have been working real hard at this.
This is a new type of bird flu has been detected in U.S. dairy cows. Egg prices are breaking records across the country, and they are only set to go higher this year.
I remember talking to someone on the phone saying, no way. There is no way that was avian bird flu. Does not affect cows, and it does not make them sick.
That affects our protein availability for feeding folks.
That one, literally a goose fell out of the sky, dead, and landed in his pheasant run. And 2 weeks later, they had signs.
California has really taken the lead here with the amount of testing that they've been doing. Many states have not been testing as aggressively.
I think the thing about response is that you can't really turn it off when you go home.
I remember it very clearly because it was 7 a.m. Monday morning, and I got a call from a vet I know, and I know the only reason he would call me is if something bad was happening. So he called and said, you know, I think I'm seeing bird flu in cows. And I said, well, here we go. So I met up with him at the dairy in question. We talked about kind of the history of the situation, what he was seeing, what kind of led him to think it was bird flu, and then I immediately went and called my boss, and we got the whole process rolling, instituted quarantine, pulled samples, the whole thing.
I believe it was about 7:30 in the morning when that veterinarian called me to say, we have a sick cow. So she and I strategized on what we needed to do for the day, which was to collect samples. I also then placed calls and looped in Dr. Jones, Dr. Adam Smith from USDA, and so that we could start to get our team organized. So those first 24 hours was twofold. One, on the ground, we were needing to collect samples and get diagnostics and figure out what was going on and get those submitted so that we would know if we had an actual confirmed case. And then at the same time, we were organizing and putting together the bare bones of the incident management team and what we needed to ride out that first week that we knew we were going to need, which was going to involve organizing staff as well as doing a lot of messaging to public health and the executive office and other agencies, because everyone was waiting for this to happen.
The initial thought was, oh no. Because California is the largest dairy state in the nation, and where we detected it, unfortunately, was the heart of our dairy country. So there was definitely concern about that. And as we watched it in other states, even with controls in place, you know, some states quarantined dairy, some states didn't. Some states had stronger controls than others. But regardless, it did seem like the virus spread from dairy to dairy. So again, you know, the oh no was definitely the first thought. And then the rest unfolded from there.
In the beginning, it is madness in the beginning. In the beginning, everybody needs to be deployed yesterday, and it's really hard at that point because we don't know how many people we're gonna need or where they're gonna need to be.
I got a call from Dr. Jones, and she said, you're the liaison officer, but I'm always the liaison officer. And we needed to make notifications, confidential advanced notifications. So the first person that I call is the agricultural commissioner. And I try to tell them as much as I can, walk them through the, you know, what's gonna happen, answer any questions that they may have. Typically what they ask me is, what's my role? And in reality, there's no role, specific role for them, but what their role is at their level is if they think they can entrust county partners, other agencies in the county that need to know about the start of the incident and the animal disease that we're responding to, and impress upon them that it is confidential, then he can go ahead and fill that role of notifying them so that they're aware.
Okay, yeah, so this last iteration of our outbreak, which started at the very end of August, was a little bit different than the previous 2 years, as it started off in the dairy industry, the livestock industry. You know, that first 24, 36 hours was mainly doing contact tracing, finding out where the virus came from, working with the owner, working with multiple other people that potentially could have received animals from the point source. And then, you know, obviously movement control in the best we can.
So at the beginning of the incident, I received a call from my boss, and she told me you're deployed to the avian influenza incident in dairy. And I was like, what, in dairy? So there's no time to think. So the first steps you have to take, start planning for the IMT and start building a structure, start talking to ICs and start talking to other section chiefs to see what we need and what is our objectives and what is our goals. And that's how it started.
So the first steps in response were meeting with the accredited veterinarian and the owner. On my way there, I'd actually already called my boss to let them know what I was going to go and see. Just based on the history, it couldn't have been more perfect. It all lined up exactly right. So the odds of it being that were pretty darn high. So I wanted them to all be aware that and not caught off guard when I started sending samples in. So we sent the samples. By then I'd already quarantined the dairy, and we had kind of started the process of limiting animal movement and monitoring the situation.
So because high-path avian influenza, or H5N1, also has the potential to infect people, and that there have been some documented cases throughout the United States from people who were exposed to infected cattle or infected poultry. Public health has been very involved in this response and in watching what's happening on the state level.
In today's Health Watch, California has declared a state of emergency after America's first severe human case of H5N1 bird flu. The Louisiana patient is in critical condition with severe respiratory symptoms following exposure to sick and dead birds. This is the 61st confirmed human bird flu case this year.
Yeah, so one of the biggest concerns would be factoring in public health, as the virus, influenza is a virus that can mutate pretty readily, and it can mix with other influenza viruses. And as it does that, there's potential for it to become more virulent. Currently, the strains of virus that we're seeing on our dairies, so B313 here in California, but we're also seeing some D1.1 on a couple of dairies outside of our state. Those viruses don't appear to be transmitting human to human at this point in time, but there is potential if viruses mutate that then they could spread more readily between humans and cause more severe disease. So that is one of the biggest concerns.
We immediately started talking to public health. In fact, we had just finished an exercise with the State Department of Public Health a couple weeks before our first detection. So we were ready to prepare and respond with them. And the way that we did it here in California from an incident, there's lots of different ways you can work with public health when you're responding to an incident, and it kind of depends on the size of the IMT probably. So like in Colorado, I think they were embedded in the IMT itself. But here we coordinated with public health through a multi-agency coordination group. So, and we shared it in our liaison officers and agency reps, just shared information back and forth, not only because we were monitoring our own employees, so we needed to report our own employee public health status to the Department of Public Health, but also just for getting information on employees, enforcement of employee protection rules, things like that. So that mostly happened outside of the IMT, but there were people on the IMT whose job it was to keep public health informed.
every time I get a presumptive positive, whether it's a poultry premises or a dairy herd premises, then I will notify the California Department of Public Health, give them all the information that they need so that they can be able to notify the local health department, which is public health, and that is the communicable disease officer or investigator, so that they can start monitoring the workers on the farm that's affected.
Right, so for the general public, the risk is still exceedingly low. The people who are at risk are farm workers, people who handle domesticated animals, livestock, and really don't drink raw milk. It's really not a good idea given everything that's happening. And again, if the more people get exposed to this virus, the more likely you are to see a mutation that will allow for human-to-human transmission.
The public health department also engages with the producers and their workers, offering them potentials for influenza vaccination, offering them PPE, masks, gloves, Tyvek, that sort of thing, giving them pointers on biosecurity, and also, monitoring them as well and responding if there's any symptoms or clinical signs in humans that have been associated with the outbreak. That's certainly one of our biggest concerns is having this jump into humans and a human-to-human spread, which we have not seen yet to this date.
So bird flu in cows, we were in the fortunate position of being able to see it evolve in other states before it came to California. And it was something that we really knew so little about that really helped, because we could kind of see, what worked and what didn't work. We thought we could get an idea of how it spread and what animals that it affected. So while it was moving through other states, we were able to do some planning. We were hoping that it would never come to California. We have border stations, we have import requirements, we inspect trucks that come into California. But I think just with so many cows moving in and out of the state, it did, eventually there was a gap in the protection, and it was transported into California. And so when it first happened and we detected our first case, we already had a plan in place for what we'd do. And we quarantined the dairies, and the plan really focused on trying to contain the spread, because we were hoping that we caught it early. Initially we knew we had kind of 3 affected dairies right from the start, and we were really hoping to contain it there. So we activated an incident management team like we usually do, and started focusing on containment.
So the IMT is really structured kind of like a pyramid, with the incident commanders at the top. And then also just under the incident commanders, we have the command and general staff. And the command staff report just to the incident commanders, and they handle a lot of the outward facing information, public information, liaison officer, those kinds of things. And then the general staff are the section chiefs that really make sure that all of the objectives get fulfilled and implemented down at the operational level.
As the incident planning section chief, my job is to help bring clarity and structure to the response efforts, especially when things are moving fast. One of the main tools we're using is called incident action plan process, or what sometimes we refer to as the planning P. If you never heard of it, it's a visual that maps out the entire planning cycle we go through every operational period. The straight line of the P represents the initial response, which is getting organized, understanding the situation. Then the round part of the P shows the repeating cycle we follow, setting objectives, developing tactics, reviewing the plan, and briefing the team. It keeps everyone from field crew to leadership on the same page. It's not just paperwork, it's what ensures the whole response moves with purpose and coordination.
What I do is I help the incident, find people to fill positions that are needed in the field and in the office. That can also mean planning ahead to do regular routine rotations. It can also mean finding people at last minute to travel and be on incident next day if needed or if possible. I also help people with their travel arrangements and help them rent their cars, find their hotels, and make sure everything and all the paperwork is done correctly to do those.
So my role as the finance section chief is to ensure that there's a payment mechanism and that everything is being logged and tracked as far as what's being spent on the incident. So as far as creating contracts, using P cards from either VICs or EPR staff, and reconciling those at the end of the month, as well as doing any kind of emergency purchases while we're on the incident. So if I get notified that we're going to be doing a depop, they'll let me know all the equipment that they're going to need, all of the supplies that they'll need, and I'll make sure that there is a contract in place for any equipment and services, and that anything that would require a P card has all the approvals and receipts and tracking information for that. And I also have to make sure that everything that we're purchasing, especially if it's over a certain amount, is emailed out to Avian Indemnity or the livestock side with USDA to make sure that we can be reimbursed for it, and if they need any additional information from us on the finance side.
Yeah, logistics section chief is kind of like some of the other positions where it's a little bit of everything and it has some crossover. First and foremost, we're a little bit of safety, and that we're charged with making sure and ensuring responders have the proper PPE and other elements and tools necessary to do their job safely and effectively. Sometimes we're participating in planning with operations. You know, we need to let operations know what they can and can't get, and what's possible for those ops. And yeah, I would say we just make sure that everybody has what they need in order to get the job done.
Basically, right now what I'm doing is facilitating and executing any operations that the team and the ICs deem relevant to the incident. I keep track of all the personnel, make sure we have enough personnel, enough equipment, and whatever we need to facilitate and execute the objectives set by them. So monitor each prim to make sure they're following all the guidelines and keep on pace so we can close them out. And then if there is any bigger operations, then I help get what they need and get the right people in place and execute that operation as needed.
On this response, what's been different for me is that, particularly on the dairy side, since we didn't have a playbook like we normally do on the poultry side, is that we really had to establish our goals and objectives for the dairy response. And so we really decided and strove to operate and run the incident by objectives. And so one of my main goals and jobs as the incident commander was to set those objectives for the operational period as well as for the near future in terms of what we were trying to meet and trying to achieve, and realistic timelines to be able to achieve those goals. So once we set the objectives, then it's also our responsibility as incident commander to make sure that the rest of the incident management team is able to meet those objectives. So we have to make sure that we're getting adequate resources, so enough personnel. We have the appropriate timelines. We have any equipment, supplies, whatever, that are there. So we're oversee the entire response. And while we don't do the individual details, like there is a logs chief, et cetera, but we want to make sure that they have the resources and the tools that they need to do their job.
So USDA's role is mainly an administrative function. We also engage in some of the field activity that the CDFA engages in. A lot of our work is through cooperative agreements with the state that allows for a matched amount of work from both CDFA and USDA. Specifically on the poultry side of things, there is a lot of restrictions as far as HPAI detections go, where we have to follow the premises out through virus elimination and cleaning and disinfection, all the way through to restocking. So a lot of the administrative function of the USDA handles that.
As incident commander, then we're also involved in, again, just making sure that from start to finish, we know where the response is headed and what our end goal is, so that we can continue to base not only the objectives on the operational period, but on the entire incident, so that hopefully we get to our desired end state.
And in every operational period, we have incident action plan. Helps everyone to know what is the objectives of the next operational period, what actions and resources are needed to meet those objectives, and who's doing what and how it all fits together.
Yeah, as a liaison officer, also known as the LNO, I am the conduit of information and assistance between the incident and external organizations and stakeholders. Some of those stakeholders include the Agricultural Commissioner, the county emergency management officials, such as the Office of Emergency Services. Sometimes I will interface with animal care and control as well, environmental health and public health, as well as the California Department of Public Health at the state level, and the California Office of Emergency Services if they are involved. I also communicate and plan and coordinate with industry, poultry and cattle industry. And there have been some industry partners that have really been assisting and supporting us during this incident.
As disposal supervisor, my main role is to find proper disposal methods after depopulation that meet the public health regulations, environmental regulations, and keeps the public health healthy and away from this disease. That entails landfill use, composting, and a few other alternatives that we use. In this incident with HPAI, we typically follow the USDA protocols, which is for composting on site. This is one of the most viable measures of virus elimination, and it allows us to have a finished product that can be utilized in our agricultural system. So we are not increasing the amount of material being put into our landfills, which is a big initiative in California, reducing the impact on our landfills, reducing the impact on our rendering facilities. So composting is right now our #1 option and one of the most viable options for disposal of these animals.
My role as an environmental sampling coordinator is that I'm in charge for all the environmental sampling coordination and preparation. So we get requests from the field for environmental sampling to take place. I review the requests, make sure all the information's accurate, review the structures or facilities that we'll be sampling, and verify them with our own information system, make sure everything's correct. And then I prepare the environmental sampling kits, and then we coordinate with the laboratories that are receiving these samples to make sure that they can receive these samples. And then I get the teams ready for the sampling, and then I actually go out and do the environmental sampling, and I'm one of the leaders to make sure that we get it done successfully. And then I ship the samples and provide results when we get the environmental sample results back. I send them to our personnel to make sure that they have those results.
So a surveillance program for any outbreak is going to be setting up control areas, issuing and releasing quarantines, and then coming up with a testing plan and making sure everybody has all their testing supplies for all the farms that fall into the control area. We also want to make sure that outside the control area in the surveillance zone, that those producers are aware of what's going on. So it's a lot of phone calls and a lot of issuing paperwork.
In general, as a case manager, we provide any sort of assistance to the dairy producer in terms of how the quarantine works, any sort of biosecurity, assistance with them filling out forms, especially regarding the premise support agreement, and just getting as much history or epidemiology of the herd as possible.
So the GIS role in the high path response, we play a critical role during the animal disease outbreak, and our job is to really pinpoint and capture the location of the infected area so that we could help the incident team to put a quarantine surveillance zone. It's typically a 10K kilometer, and it helps capture the surrounding premises that can potentially have the transmission.
So every operational period, we meet several meetings: objectives meeting, command and general staff meeting, tactics meeting, planning meeting, and there's sections meetings too, so everyone knows the whole picture.
Each of our case managers, or we also had some tactical EPIs who were here, went out and interviewed or provided an EPI questionnaire to every one of our facilities that ended up affected. Some declined to answer those, but for the most part, we were able to collect epidemiological information for every premises. And usually what we focus on collecting are movements on and off the dairy within the 30-day period prior to the outbreak or prior to their positive result on that particular premises. And then we look at whether there are connections with other positive dairies in that time frame to kind of determine how the virus possibly got onto the dairy. So that was a big part of my role, is just collating all of the data that was collected and trying to track the different prems. And then we also do genetic sequencing on a lot of the laboratory results that were submitted. So we collect milk samples at every dairy, which is how we determine whether they were positive or negative. And then those milk samples with the proper cycle thresholds, which have to be pretty low cycle thresholds, we're able to sequence the virus, and then we can tell relatedness of that virus to viruses on other premises to determine a little bit about how much connection there are. Now, we had quite a few connections between a lot of our dairies of same providers, co-ownership, movements of animals, and it was a bit hard probably for us with the amount of dairies that we have to pinpoint one particular way that the virus got onto each of our dairies. It was more just kind of spread laterally through the dairies over time with close proximity.
So at first, when it wasn't very many dairies, we were sending kits to every dairy so that they could just test their own bulk tanks and test their own cows and see if there was virus. When it got much bigger, that became too laborious, and the cattlemen were busy. They were treating their cows. So we started working with the creameries, which are where the milk from each dairy go to get processed. And we actually use the dairy testing labs that all of these creameries use. So we'll have maybe 3 or 4 creameries use one particular lab, and they test their the quality of the milk, bacteriology, anything like that. So it became a nice central area to get samples from every dairy we needed. So the creameries gave us permission to use their samples because they're the ones that own the samples that come from each dairy. As the milk truck picks up, they would get a little tube of milk, and then those tubes go to the lab, and then we would give the lab a list of dairies that we would like to test and go pick up the racks of milk samples and get them all packaged up and then ship them to our diagnostic lab.
Yeah, we rely the data on EMERS, because once it goes on EMERS, it's considered official, and so it's more accurate data that we use. And having the data, we are able to zone in the exact location or the coordinates. For us, is we rely on the coordinates on the map. Then we can put a effective red star indicating that it's under quarantine and isn't infected. And then it goes through a process with our field team and our incident team. They are able to do their work and, do their testing. Once the testing is, complete and it's official, then we get EMERS data update, that is quarantine released, then we could use that data to make changes on our map, indicating a green star to show released quarantine and green surveillance zone, 10 kilometers as well, to reflect those changes.
Well, they go out, all the case managers, they report to us every day. I mean, we're following the ICS structure, so all of them go up through ops and they report to us so we can track everybody. And so they're the ones with their boots on the ground and out visiting and talking to the producers and relaying all the information and getting information from them and relaying it back to us so we can get it put into the system and coordinate with everybody else as far as biosecurity tests, audits, sampling, anything of that nature. So they report back to us and then we get it out to whoever it needs to be sent to so we can get that started.
When we started, we talked about sample kits that we're sending to the dairies. This is not a real dairy. This is just our sample. But we would, and we still sometimes, if we have a dairy that we can't get a creamery sample for, like a raw milk dairy, we'll send them a kit and they can take their own sample and send it to the lab. So the kit arrives and it has a lab submission form for them. And we put the name of the dairy and everything like that. They just have to put the date of the sample and sign it. We have some instructions just on how to pack it up. And we'll send them these tubes for the bulk tank and their hospital tank. And then we send them all the FedEx packaging things, including a label. So it goes to the lab and they don't have to pay for anything. They just have to get their samples, put it in the multiple bags that just kind of keeps it as clean as possible. They get a FedEx thing to put the box right in, and then there's a label in there as well that they can put on that and just go straight to the lab. So this we'll use in cases that I can't get creamery samples, or they have sick cows and we want to do actual individual cows maybe versus a bulk tank sample.
So when a sample arrives to the lab, it is generally indicated whether or not that needs to be handled in our BSL-3 lab for testing, or if it can go to the main lab. Most of the outbreak associated samples are being handled in BSL-3, so all of those packages get transferred to our BSL-2+ receiving area, where the boxes are opened, all of the samples are taken out, disinfected, transferred into a biosafety cabinet where they can be opened up and organized into a rack. And we have the paperwork with it, so we can create an accession in our laboratory information management system, our LIMS system, that then would allow us to print out labels. We label all the tubes, disinfect it again, and then it's ready to be transferred to through our pass-through, or the biotech staff can pick it up for testing. If it's milk samples or dairy or creamery samples, oftentimes they come in larger tubes than what can be transferred in the racks that are used for testing. So then we will take those into the biosafety cabinet and take an aliquot out and transfer it into a smaller tube that then goes into the BSL-3 for DNA extraction first, and then PCR. It depends on how early in the day we can get the first run going. So fortunately, we've been getting our samples in very early in the morning so we can get them on run. If it's a positive sample, then the entire test is repeated. So extract it again, PCR to confirm that it's a positive sample. So for a high priority testing, we get that done the same day. If it's lower priority, then we could repeat it the following day, but generally the same day.
We usually call them as soon as we find out that the herd is tested positive, and then we set up a time to meet them. And during that phone call, we let them know, hey, you know, your herd tested positive. We're going to have to place you under quarantine, and maybe just briefly describe that, and then set up a time to meet them, usually the next day in person, preferably, and then go over the terms of the quarantine, which usually involves movement procedures requiring permitting. And so there's a flow chart we present. And then we discuss biosecurity measures for the premise itself, and provide information so that they can get the employees the proper PPE. And then we discuss with them a little bit about the financial assistance that we provide for the farm. And then probably most importantly, we go over a short little questionnaire asking them as much information about the dairy that we can get, as far as where cattle have been in the last 30 to 60 days, where cattle come in, where they ship calves out to if they do that, who their veterinarian is, who their trimmer is, who the breeder is, what calf ranch they go to, who the milk hauler is, and then we go over the biosecurity for all of those people that are coming on and off the farm.
While the dairy situation was very surprising and new for us all, it didn't super change how we reacted to poultry detections. We made sure that poultry farms were under the same requirements as usual because the disease on a poultry farm is the same. However, we had all of these new dairy infected zones, and so we wanted to make sure the poultry farms were prepared and aware of what was going on there. So what we did was, when we had a new dairy infected zone, we would call the poultry producers and let them know what was going on, have them increase their biosecurity standards, and let us know if they had any increasing mortality or issues. And so we would try to reach out to them weekly as time went on, as best we could. So the sampling methods we use are fairly non-invasive. So we're gonna take a cotton swab and just take a sample of basically the oral fluids of a bird. And so it's called an oral pharyngeal swab. You just take the cotton swab, you open the bird's mouth, and you gently kind of rub around the mucosa in the mouth and then up the choanal slit. And that's it. And then for some species, such as ducks and geese, we're gonna flip them over and do a cloacal swab. So it'll be the poop shooter area. Then we'll take those swabs and we'll combine them into a tube of fluid called brain heart infusion broth, BHI media, and then we'll ship that to the lab and they'll run a PCR test on that. It's how we get rapid and efficient and exact tests.
It's just the nature of the dairy industry, right? So animal movement is a huge part of how dairy works. It's not like poultry. It's not all in, all out. It's not every animal sits at this facility. So typical dairy, you know, they may think they're a closed herd, but they send their calves off to a calf ranch. They get heifers back from a heifer ranch. They sell fresh cows. They cull cows. A ton of movement happens. So, or they own multiple dairies and they'll send fresh cows from one dairy to another, dry cows back to a different dairy. The sheer volume of movement is beyond what most people even understand. I was a practicing dairy vet for 15 years. I'm well aware of it, and I assume other people are when they aren't always. But that's probably the biggest challenge, because we know animal movement is still the biggest risk factor for spread of this virus. So, and you look at where a lot of the jumps with this virus happened, it had to do with animal movement. So that's a big part of it. The other big part is at some point, you know, some of these initial dairies were huge dairies in very central locations with a lot of nearby dairies. So you look at just sheer viral load in the area became incredible very rapidly. I think that contributes to movement issues, so vehicles, people, you know, different fomites, even wild bird populations at some point become part of the problem too. So a lot of factors, but that initial just high volume animal movement, that's a big problem.
I think the biggest challenge, well, the blended remote and on-site, again, it was a challenge and also a positive development. It made things a little bit easier and harder. But the other thing was the number of staff needed. And then as we progressed through the outbreak, other states were having major issues as well. So staff from USDA were getting pulled into other states. So I think just staffing levels, and you can't just instantly increase staffing because a lot of the positions need training. And so we were even pulling people from other areas of the state into the Central Valley. It's like a whole new world to some people in the Central Valley. So just having enough people that were familiar with the industry and a job, which was being defined as we went. I think that it was really just resource availability.
So I would say the biggest kind of, this is a unique position. I mean, they all are in their own way, but with this one, because you're basically handling all the financials, anything that's being spent on the incident that's not covered by USDA, we are essentially handling. And the amount of paperwork that it comes with and approvals, and depending on when it happens is when we really start to hit kind of the roadblocks. So if we hear that we might have a positive prem on a Thursday and we get the results back on Friday, I'm letting admin staff in contracts, acquisitions, P-card, I'm letting them know all ahead of time, hey, just letting you know, we got a positive prem. There's gonna be work going on this weekend. Nothing that should hopefully be contractual, so I shouldn't need any contracts, but definitely P-cards for supplies will probably need to be had. And then anything that might be kind of an emergency purchase that's not a contract. Because if it's a contract, it's a service, and we cannot start any services without an approval from the contracts department.
For us in the beginning, it was the volume of cases that we had. We just didn't have the resources, I would say, to keep up with getting around 50 to 100 dairies a week new. And so it does take time to do those epi interviews and to gather that data. And so when you're trying to analyze that volume of data, you can be a little bit behind in trying to slow or stop the spread. So I think that was a challenge for us. Sometimes producers are very good at sharing information or have really good records that make it easy to track, and other times, you know, there might be gaps in the information that we receive, making it harder to track where the virus came from and also possibly where it went to.
I think the key logistical challenge is that, you know, California is the third largest state, and that this virus is so widespread throughout the state. just making sure that everything gets where it needs to go in a timely manner, and making sure that logistics isn't the reason that there's operations that can't continue safely and effectively. So we've addressed that in a couple ways. Sometimes in the past we've had multiple incident command posts. We address those challenges sometimes with staging areas, but mostly it's some relationship building both with vendors and other responders to make sure we have what we need and the time that we need it.
The biggest challenge on this incident was just the rapid pace of which when it started. We had a lot of them. It was moving real fast through the dairies, and then the poultry hit, so we were going different directions. We were in a smaller ICP, and we had to transition and find a bigger one, so that took a little bit of effort, and finally located this place we're in now and got it secured. So then we had to transition everybody and everything we had at the old ICP and get transitioned here. And then once we got set up and established here, everything started moving rather smoothly, as good as could be. It was just a challenge just because of the rapid pace in which all these premises were getting infected.
The biggest challenge for this current outbreak is the unprecedented scale. You know, in previous years, we had much smaller outbreaks. You know, we did have, at that time, the largest outbreak in history, 2 years running. And this year, it blew out of the water. We have almost 3 or 4 times the number of poultry farms affected by highly pathogenic avian influenza this year than in previous years.
The biggest challenge was convincing at the beginning when the virus was very new, and I think a lot of dairymen figured they wouldn't get it. It was convincing them to do the testing and convincing the creameries of why we wanted to do their testing and test all these dairies. We kind of had to convince them that it was important and that we did need to do surveillance of the entire state. Once the disease spread, everybody kind of jumped on board because they saw it going and they wanted to know whether they had it or not. So I think the biggest challenge, though, at the beginning was convincing everybody that we really need your help. I mean, you know, we're the state. They don't necessarily want us to quarantine them and, you know, come down and, you know, tell them they can't do things. So they were a little hesitant, but once they saw how fast the virus spread, I think that helped a lot with everybody to cooperate with us.
So the biggest challenge with coordinating environmental sampling is that the field or producers, unfortunately, can't just choose whatever day works for them. We have got to choose a day that works for the laboratories, because the laboratories ultimately are doing the processing of these samples. So we have most of the time 2 laboratories that these samples are going to from California. So, and then we also are faced with weather challenges this year. That has been a challenge, where in California it's 70 degrees and beautiful, but our first laboratory that the samples go to is -16. So we have had one situation where we did have to redo the environmental sampling because the samples just did not make it in time due to weather delays. So we have to sample on Sundays so that gives enough time for us to, because FedEx, where we ship our samples, is closed on Sundays. So we sample Sundays. First thing Monday morning, we go ship the samples. They go to the first lab, Minnesota. They get there Tuesday. They run their PCR test on Tuesday, have to get it back on a FedEx truck by Wednesday. It goes to then another lab, Iowa, and has to get there by Thursday. So that's why the timeline, it has to be, if we did this Monday, it would have to be done first thing Monday morning and then get to a FedEx, you know, the FedEx by 10:30. So that's why we do Sunday sampling, because of the scheduling with the labs. And that's something that we've had to explain to the field staff. Well, I know you're ready Tuesday, you're either gonna have to, you know, you have to wait till Sunday for us to sample a couple days, because this is a lab coordination. And luckily we have not had a lab say they cannot accommodate the labs we've been sending them to. They've been able to accommodate all of our samples, but they themselves do have a limit. They, you know, we can't do more than 200 samples at the first lab. That's our limit. So we would have to find another Nolan lab to send our samples to if we went over 200.
I believe that what has helped is that since 2022, I've been fostering relationships and nurturing them. So it ended up serving a purpose now that we have more involvement from the county level and state level in responding to the dairy herds, because like I said, it has a human component. There's more interest in it. I have probably gotten more cooperation now. There's more of an interest to assist us. So as a liaison officer, there are times when I'm involved not only in information sharing and assisting, and also to provide situational awareness, but there are times when I am asked to ask the county for a resource, such as a facility like an ICP or a warehouse for storage, or if we need a water source to depopulate a poultry premise, or if we need personnel for helping us in the field or to assemble test kits, for instance. So I think that all of those relationships that I've been, developing along the way really paid off during this incident. They were more readily available to cooperate with us.
The toughest part is when you do put in very long hours and everyone wants to make sure that you get to everything you can. And sometimes it does seem like you're not making the progress you want to make. And the long hours cause you not to have the time where you can take a step back and refocus. I've always tried to make sure before I start a new day that I've refocused, and before I talk to a different producer that I've taken a few moments to refocus. Because it may be the 9th time I'm sharing that message, but it's the first time that producer or that stakeholder or that fellow team member has heard the message. I need to make sure it's fresh. Long days make that harder. And people, I don't know that some people realize how much is done in order to help. I realize when we don't do our job as effectively as we could, if we don't communicate as eloquently as we should, we're seen as just an annoyance, just a paperwork that has to be checked off. I will do everything I can to make sure that I'm as eloquent as possible. I am also going to ask every single time, please, if you have any concerns, contact us. We'll explain exactly why we're asking for what we're asking.
I think the biggest challenge is that it doesn't make them happy, unfortunately, because it restricts their typical movement, and especially getting cull cattle out. They have to have permitting, so it takes longer to get that process going. They can't just take their cows and take it to anywhere. They have to go through a permitting process, so helping them with that as much as possible. And it is frustrating for them because they're not used to it. And then, when they take these cattle for the sales and such, it does affect the price of their, the price of the cow that they get at the sale.
One of the biggest challenges we had, it was resources. So we exhausted most of our employees here in CDFA and local USDA employees too. So we had to ask for help from other states, from the national incident management teams. And we got so much help, and that was amazing.
Yeah, so I have been the state veterinarian in California for about 20 years, and I have seen a lot of different outbreaks.
As the Director for Animal Health and Food Safety Services, my primary job is to be sure that we're all working together in order to meet our mission. I'm Dr. Annette Jones, the California State Veterinarian, and I'm here to provide another update of virulent Newcastle disease in Southern California poultry. Foot and mouth disease is a highly contagious virus. It has huge impacts for the the countries that have been unfortunate enough to have outbreaks, and it is all around the United States. And I'm here because we're getting a lot of questions about rabbit hemorrhagic disease, particularly the type 2 virus, which is currently being detected in several southwestern states in the U.S.
I've seen outbreaks affecting many species, so from mad cow disease in cows to influenza, Newcastle disease in poultry. We've had sheep issues, we've had pig issues, but I have never seen anything like this virus. In fact, I didn't even think, when I first was hearing rumors that someone said this mysterious illness in Texas that's causing these cows to get sick, I heard it was avian influenza. And I can remember talking to someone on the phone saying, no way, there is no way that was avian. Bird flu does not affect cows and it does not make them sick, but it does. So that was the start of how this outbreak has been different than any other one. It's a virus we didn't expect to affect cows in cows, so we changed species. And then we kind of knew that it was going to be difficult to stop the spread in cows because we had a euthanasia and a virus elimination strategy was not going to work for dairies. So we knew, and we'd seen other states, so we knew it would spread. And so we stood up an IMT, and our policies were around that. I think the way that it was different is the number of dairies that were impacted, so scale. And then when the poultry started to get infected from the dairies, so now we have poultry farms that were getting infected from dairies all around them, and then also from wild birds. So just that the scale was just off the charts as far as workload goes. And that was probably the biggest difference. Oh, and the other thing is the engagement from the health department was at a very high level, and we hadn't really experienced that before.
The scale and certainly the livestock component of the outbreak has really changed the game as far as this outbreak goes. Generally, what we've seen with high-path avian influenza is that it infects in the wild bird flyways, and eventually, usually a season, sometimes maybe 2 migratory seasons before the virus works itself out of the population. This particular virus has maintained in our North American flyways for going on 3 years now, in addition to having 2 separate point introductions into the dairy cattle industry, which has further spread among dairy cows. So certainly an added level of complexity with the dairy cattle in there, and just the sheer scale of infections that we've been seeing this past 6 months.
The approach to the response is different between poultry and dairy. And that really goes back to the fact that this disease, this H5N1, also called highly pathogenic avian influenza, and that name, highly pathogenic, is because it's pathogenic to the chickens, to poultry. So it is a mortality event in poultry. So poultry die from this. They become sick, it's very contagious, and they die. Whereas cattle, it's what we call a morbidity event. They don't die from it, they just get sick, and most recover. So that basic biology drives a difference in how we respond. The strategy is based on the fact that this, like I said, it's a mortality event in poultry. In cattle, because it makes them sick, it's much more of a mitigation effort. And so we were aiming for herd immunity in cattle because they can get through the illness and then recover. So we want to slow the spread, again, decrease the viral plumes in the area. We don't want it going rampant through the state. But it's about getting through the virus and the illness and reaching a level of herd immunity in the cattle versus the poultry. Very few develop natural immunity to the virus.
So we do environmental sampling to prove that there is no live virus in these previously infected poultry facilities. So we want to confirm that there is no live HPAI virus anymore, and that the producer, if they choose to do so, can safely repopulate their farms without worry that their birds will get infected again with HPAI virus. So it's a critical part of the process because we're going in and swabbing surfaces that would have had virus on them and confirming that there is no live virus. And it's critical in order, they have to get negative environmental samples back so that the owners can safely repopulate and then have a quarantine release and all the other things that come after that. So when we go to different facilities and we're ready to collect environmental samples, it depends on what kind of facility, what type of birds were housed in each facility. So if it was a meat duck operation, then these were floor raised birds, and we would be looking at sampling the feeders that the birds would have been eating in, the water lines, and then we'd sample any fans that are present in the poultry houses, as well as the walls and posts. And then we also sample our boot covers because that would account for any virus that was tracked on the floors. So it depends on the species type, what samples we collect. If it was a layer operation or birds that are laying eggs, then we would be sampling egg belts and manure belts. So those are the surfaces we're looking at, but in summary, we're looking at surfaces that would have had high virus. Environmental sampling results help guide the quarantine release decisions because the owner, USDA, CDFA can all have confirmation that there is no live virus, so they can safely start getting back into business and move things along towards quarantine release, because we have gone in there and proved that there is no live HPAI virus present anymore in these barns. So that's a great time in this stage of the process. Here you will find our Tyvek suits. So our team members come in here and it's like a Costco for PPE and supplies for environmental sampling prep, and they can get their Tyvek suit, their boot covers, gloves, bouffant, N95 masks, and safety glasses. So they just get a bag and they come and get their PPE needed to conduct environmental sampling. And over here, we have a note for our team leads for environmental sampling on the things to remember to grab with them. So they have to bring extra gauze, the environmental sampling map, which says which structures and where to go for sampling, scissors, a first aid kit, water for the team members, Lysol, and Sharpies. So here are some of the scissors. We use these to cut the gauze bags. So these are the gauzes that we use. So we'll go in and sample different surfaces using these gauze. And these would be wet with solution that will pick up any live virus. And once we get the sample, we come back, we massage this, and we cut the bag with these scissors and then pour this sample into a tube. And those tubes go to the lab. PPE area for our environmental sampling team.
The role of the permitting team is to allow continuation of business movements for premises that are located near an infected premises, to give them the biosecurity protocols to make sure that those movements are as safe as possible in order to decrease any potential lateral spread from the infected premises. We also work with that infected premises to make sure that what movements they need to make or equipment needs to come on or off, we follow the biosecurity protocols and also, once again, minimize any potential chance of lateral spread. We want to make sure that exposed ranches that are in the area stay uninfected, and then if you happen to be outside of the area, that you can remain unexposed. So that's the goal, to make sure that business keeps going, and we do everything that we can to help the producers and the haulers and the stakeholders follow protocols to minimize potential risk of disease spread.
Biosecurity is just the actions that we take to try and keep from tracking virus onto or and off of a site. So it's critical to what we do for disease control. The trick was with dairies, biosecurity is a new concept because they're an open environment. They have movement all the time. And there's many people, there's service providers, there's employees, there's feed trucks. So Starting biosecurity on dairies was an uphill battle from day one, but that was our #1 first focus, was, trying to look at the dairy and are there practical ways that we can try and contain the virus. The good news there is we had been working with the dairy industry and planning for decades, really, to be prepared for foot and mouth disease, which is probably the most contagious virus known to man, highly contagious virus. So we had been doing some work with dairies in our secure food supply plan on most critical biosecurity to implement. That said, it was still a challenge.
I'm fortunate enough to work with some amazing doctors and epidemiologists, and we partner quite often with the epidemiology group to do risk assessments on requested moves to find out what is the safest way to be able to do that move. And sometimes some movements do have to be denied, but most of the time we find the safest way to do that to make sure the producer can continue with business while still protecting not only their origin ranch, but also the people with whom they do business.
So the big things that we've always talked about, that message has never changed, is animal movement. Be aware of where you're moving your animals, why you're moving them. Is that movement necessary? Where are they coming from? Who are you buying from? So if you buy fresh heifers, be aware of where you're buying them from. In any way you can quarantine or be more mindful of those movements, do it. As far as your more typical biosecurity, the focus a lot was on protecting workers. We know this is zoonotic to some extent. That's to be expected, but you can protect your workers. So proper PPE, gloves, eye protection, washing hands, cleaning your boots, not tracking virus home. These things all matter. So we've pushed foot baths. So having a way for guys to wash their boots, and then at the very end of the day, they step through a disinfectant so they're not taking a bunch of virus home. Things like that, they all matter. So is it the entire answer? Absolutely not, but every little thing, right?
Probably the most complex one is on two sides of the incident. I won't get into the specifics, but we had a producer who's needed to restock his premises. It wasn't affected premises. They did everything they needed to do to get to the virus elimination stage. And now it's that day where, cool, now it's safe for you to restock your premises. And they're restocking from multiple places. At the same time, unfortunately, another producer is on the other end, and they have materials that need to be transported off. So coordinating that the animals coming in go nowhere near the materials that are coming off the other one, when, unfortunately, in this situation, the same routes had to be utilized. So not only were the animals coming in from multiple locations, they were coming in from 2 different states. So we had to coordinate with those states as well, those origin producers, those haulers, and all these things. So we take all the information we have, find a window of when the concerning materials need to be moved, and make sure that the animals are not coming during that window. But it means, once again, all the people involved, the origin ranchers, the destination ranchers, the haulers, the other stakeholders, the officials at the other states, that everything's in line. And that's in addition to what we already always do, is make sure we have the protocols in place, we have the testing in place, so that everything is as safe as possible. That was a very complex one, but ultimately it's about leveraging those networks and making sure, once again, the same thing. If a state contacts us, we do everything we can to help them out, so that when we contact them, we have that same synergy with that state.
So composting, it's one of the most safe and effective ways of virus elimination. Forefront, it's on site, so we are not moving these infected animals, these infected material. Composting, we integrate the feed, the animals themselves, bedding, manure, any organic material that was infected or exposed is integrated into this. And what we do is we bring in agricultural inputs, be that ground pistachio trees, ground almond orchard, and usually we'll cap these windrows, these compost piles, with other agricultural inputs such as rice hulls or wood shavings. And so by doing this in a proper manner, integrating it together, following the protocol put forth by the USDA, we're able to create very viable compost piles that are able to heat up to the required temperatures to eliminate the virus. And it has been seen as one of the most effective forms throughout the years of using it. And we have a very good product that we can use afterwards for our livestock and our agricultural systems.
You know, with stamping out in the poultry side of things, we have to figure out, before we depopulate, we have to figure out a method of disposal. And generally in California, that composes of either cooperation with landfills and county ag commissioners to ensure that the carcasses are disposed of in a safe manner and covered appropriately at the landfill. The other main option that we use is composting on site generally. There's a few off-site compost facilities, but when not all possible, we don't really like to move the virus if we don't have to.
The first step of composting is going on site. We'll do an on-site evaluation, typically with the farm manager, the producer, and we will look for the amount of feed that is on these sites, the architecture of the buildings, the topography of the land, how much bedding we have, how much material, how many birds, their average weights. So once we compile all this information, we also look for water sources on site, and we run an assessment. We see how much material we're gonna have to compost, how many linear feet that would be. And from there, we consult with our operators and our contractors that will be constructing this, and we will come up with a plan to build either indoors or outdoors. And from there, what we'll do is we'll start to separate the material in these houses. So we'll split the birds on the sides with their bedding, we'll integrate all the feed, and anything that's outdoors from routine composting will also be integrated into it. From there, our major things that we want to add for composting is moisture content to allow for the microbes to facilitate the digestion and the destruction of the virus, as well as different carbon sources. So we usually like to use two types of carbon. We use a coarse carbon, so this gives the pile structure, the windrow structure, allows for airflow, and allows for this microbial activity to occur. And on top of that, we also use a finer carbon, typically rice hulls, wood shavings to cap, and that kind of acts as a seal to keep the temperature and the heat in, but it also helps to eliminate vectors such as flies, any odors. It's very good at absorbing odors, and it gives us protection from wildlife and other birds that may have access to these sites. So it gives us a second set of security. From there, we usually have two phases. So the phase one of windrow is after construction. You've laid out your base, typically 6 inches to 12 inches of base for an indoor facility. That allows you to have the aeration coming underneath. And then from there, we will have that mixed core mixture, as we call it, which integrates the water content, the birds, feed, litter, bedding, manure, and that is mixed together with more carbon to allow structure. We lay that on, and then we will cap it. So that cap is usually 4 to 8 inches of cap for indoor as well. And now that we have that constructed, we start phase one. So phase one, it's a 14-day period. Over that 14-day period, we have 10 flags in each windrow, and we take an average temperature of that windrow every day for 14 days. We take it at a depth of 18 inches and a depth of 36 inches. And our goal is to achieve 131 degrees at both those depths for 3 days straight, 72 hours. And that will meet our virus elimination. After there's 14 days, we've achieved that, we will then rotate and turn the pile with our operators. That will then integrate what's on the outside into the core and mix everything up homogenously. From there, we'll do a second phase of composting for 14 days. We take our temperatures and we try and achieve again that 131 degrees for 3 days straight. Once that 28-day process is finished, we have a finished product or finished agricultural product, which is then sent to licensed composting facilities for further composting, or through the Regional Water Board and other organizations in the state, we find land and orchards that are enrolled in their IRLP, which then allows them to integrate this and use this material as a fertilizer for their orchards, for their crops as it's tilled in deep into the ground. And it's a very good source of nitrogen and energy for these plants to grow.
Those are the main two methods. There are a number of other methods that are available to us, including incineration and burial. But those methods tend to be a little bit more difficult in the regulatory scenarios we have here in California, yeah.
I think the biggest challenge of composting animals at such a large amount, it's really the teamwork and integrating everyone to work smoothly. It can be very daunting when you first come and set foot on these premises. So it's really about having good communication, good relationships with your producer, the farm managers, your case manager, and as well as your operators and contractors. So once you create a good working relationship, a good communication stream, you work together and it starts to just work out. So it's just about laying that foundation, getting your resources brought in, be that your carbon, be that your operators, be that your equipment, and then it's just having good open communication and the whole process will go smoothly.
You know, I think now that the incident is starting to stabilize, or maybe let's hope wind down a little bit, it leaves some room to think about what's next and how are we going to move forward with this. At this point, we do have, you know, over 750 dairy herds that have been infected with the virus. We have over 70 of our commercial poultry premises that have been infected with the virus. This is our third year of having HPAI hit poultry and our first year in cattle. But it's hard to see it going away in cattle. So we are thinking about, what does this mean? I don't know if we can even think long term, but you know, the next foreseeable future. And so we are looking at and strategizing and coming up with plans for how do we continue to do ongoing surveillance and manage this disease or this virus in cattle. And what does that mean for our poultry industry? You know, if the virus is going to continue to circulate and potentially exist in cattle, how do we continue to protect our poultry? And what can we do differently next year? When the wild birds come back, we do expect there to be another strain or the same strain of virus come through and put our poultry industry at risk. So here at the Animal Health Branch, when we're not responding, one of the things we do is think about what could we do differently next time and what can we improve on given what we learned over this last incident. So that's what we'll be doing for the next few months.
Outbreak response is a huge interplay of, you know, federal, state, and local resources. A lot of the public doesn't really know we exist, and that should probably be, it's probably better that way. We don't want to hear stories about large outbreaks in our food supply. I think we've had a very stable food supply and a protein supply in the United States for a long time. And a lot of that is attributable to the state and local response to various number of diseases. I always like to point to our 100-year-long TB eradication program in cattle alongside human TB eradication. We've made a lot of progress on that front and moving into more complicated diseases such as avian influenza that can be unpredictable and can have a wildlife source that we really can't treat or vaccinate.
The biggest thing that we can ask of producers is to do the best you can with your biosecurity. If you think you have sick cows, it's best to either hold them until they recover, or if you're going to cull them, you know, make sure that they're healthy enough and then go to slaughter. Don't be sending sick cows to other facilities to prevent the spread of disease.
Logistical lessons learned, I would say one of the key things for this incident, and that makes it kind of unique, is that for the first time we got a gubernatorial proclamation of a state of emergency, which allowed us to work with other agencies. So special thanks to California Office of Emergency Services, or Cal OES, for an opportunity to work with those guys and get kind of a deeper understanding of incident response and what might be available to us as we navigate these new waters.
Well, every time we have an outbreak, we run into different problems. The biggest thing this time was the dairy, because we've never experienced that before. So there was a lot of challenges and trying to track all the movement, because they have a lot more moving parts, and the biosecurity issues that they encounter was a lot different. So for us, really, that was one of the biggest challenges, and still is. I mean, it was a learning curve, because there was a lot of stuff that we weren't aware of, or some people weren't aware of. So to address all the little problems that arise, you know, just different scenarios, it was challenging for a while, but I think we're getting a handle on it and doing better.
The relationships with the creameries and the labs, the dairy labs here, is extremely important. They work very hard and spend hours actually to get the amount of samples we need. And I think if we have to do this again, I think going straight to them for the samples is the way to go, versus trying to get each dairy to do their own, because I think it just streamlines it, and we're not going on every dairy trying to get their samples. I think that's the biggest thing that I've taken out of this, is that working with the creameries and working with the dairy labs has been just an immense help.
Not sure it's a lesson particular to this, but that has been an ongoing lesson. And I hate to be redundant, but it really comes down to just making sure that you maintain those partnerships with these entities. They're very important to us. We don't work in a vacuum. We cannot do our jobs without them. They cannot do their jobs without us. Sure, the virus is in their community, and they may feel that it's the responsibility of CDFA to respond to the incident along with USDA, but they can also play a critical role in helping us deal with the incident and the virus in their community. The more that we can cooperate with each other and see ourselves as one team, the more that we can get through this together.
I think that's a tough question too. It kind of depends what it is, right? So, you know, when I went to vet school, the big thing that was drilled into our heads is FMD. We were all gonna see foot and mouth disease, and that's gonna be the big outbreak of our generation. And you know, there's whole books on how we would deal with FMD in the United States. This being a novel disease, we kind of had to make it up as we went along, right? So, and you're torn between, do you overreact, do you come down hard, no cattle movement, or depopulate your cows when we don't know for sure if that's the right move or if it would even matter. In this case, looking back, I can say it would not have mattered. The disease had already spread to other farms. We would have been chasing it every step of the way, as we kind of were anyway, because this is wildly contagious. What I would do differently, I mean, maybe, I think it was important to be very clear from the beginning that we were not going to be able to contain this in any measurable way in the valley. A lot of dairies very close together, and it's a lot of cows, a lot of movement, right? So, and I felt like I was pretty clear to dairymen about that, but that doesn't mean you don't still try to implement biosecurity and try to protect your animals and protect the area. So it's like a lot of things. The more we could slow the spread, the more it spread out resources, because especially in the beginning, we saw a lot of shortages of medications, supportive therapy for cows. A lot of that went on back order, was impossible for dairymen to get because other guys were hoarding it. So that gets kind of difficult. So trying to, I guess, better unify everybody's response to how it went, how we deal with it, and kind of define it better in the beginning. But that, again, difficult to do when it's a novel disease. So, and the information we had coming from other states that had experienced it was pretty limited and didn't always apply to our situation, because we, from the beginning, handled it much differently. So we handled it differently, right? We monitored more closely. We followed herds much tighter. We stayed in a tight relationship with all these dairies as they slowly worked their way through it, knowing that mostly we were just trying to learn from it and hopefully apply it further throughout the outbreak, which is what we did. So, but yeah, it's hard to say what you would do different. It's novel disease, novel situation. The things you know now, you could have applied them back then and people might have said you were overreacting or underreacting, but you know, that's the point of hindsight, so.
You know, in hindsight, if the impact that this virus and this response has had on so many dairies, and then the spillover into poultry, the impact on our food production has been far-reaching. And so if I could just go back and keep those infected cows out of the state in the first, I mean, that's what I think about the most. All of the resources that we're putting into response, what if we had just put all of those right along the border and followed up every cow, you know, we're at every dairy that was importing cows to make sure that, because the problem is there's this long, you know, 2-week, 3-week incubation period. So if you could catch the animals before they're sick, like right when they come in, or better yet, prevent them from coming in, that probably would have been money and effort well spent. But then again, we move so many cows in or out of state, and we don't really know the role of birds. You know, maybe it was inevitable, but that's probably the number one thing I would have wished we could have done differently. I think this is probably the most challenging response, but also the most interesting response that we've ever done. And a part of that is because we had to do a lot of decision making without information, which means, you know, we have to work together as a team. We need to listen to each other. We need to listen to industry or farmers or processors. And we used experts from every part of our division of animal health and food safety services. We worked with, you know, milk and dairy and meat and poultry inspectors and the livestock, the brand inspectors, and our antimicrobial use and stewardship and animal care. So we had to use the expertise, such wide expertise to tackle so many unknowns. I think it was just personally, it was tragic. I prefer that we didn't experience it, but it was also really rewarding.